My name is Harry Chaliki. I'm one of the consultants in Division of Cardiology at Mayo Clinic, Arizona. I'm a practicing cardiologist. And the title of my presentation is Management of Asymptomatic Aortic Stenosis and What's New in 2015. There have been a number of studies that showing that certain characteristics of asymptomatic patients that may put them at a higher risk and should be considered for early surgery. For example, patients that have a very high velocity defined as either 5 or 5.5 meters per second, they should be considered for early surgery if their risk is low. And also patients that claim to be asymptomatic but they have a positive stress test, that is also an indication for early surgery in patients that have severe asymptomatic aortic stenosis. And the other criteria depends on amount of calcification and how fast it progresses. That is one of the indications for surgery in asymptomatic patients. There are some studies suggest that changing in BNP levels would also be a criteria for early surgery, and perhaps even increase in mean gradient with exercise could also be considered for early surgery. But what's new in 2015 is new emerging markers. For example, density of the calcium, and that seemed to be associated with cardiac mortality. The higher the density, the worse the mortality without surgery in asymptomatic patients. Perhaps that could be used as a new criteria. More data will be coming in the upcoming years for sure. And also myocardial fibrosis, this is the effects of the increased afterload that we see on the heart, and increased fibrosis would be another marker to consider early surgery. And obviously we need more data before we can use that as a criteria in asymptomatic patients. And lastly, longitudinal strain, either 2D or 3D, that is kind of a surrogate for amount of fibrosis, would also be emerging as a new risk factors for perhaps identifying high-risk patients in the group of asymptomatic patients that could be qualified for early surgery. Again, more studies are needed.